Well, good morning, everybody. This is Jim Hovland, your Edina Mayor, and it is Wednesday, December 23rd, 2020, the day before Christmas Eve. You know, we've been talking about vaccines, and we know now that there's a light at the end of the tunnel. We've got a couple of vaccines coming our way. Last week, the first shipment of COVID-19 vaccine arrived. That was the Pfizer vaccine. It came into our state. It is being given to first-line workers. I was on a call with the governor on Monday morning early, and he said that by the end of next week, they expected to have 65,000 first-line healthcare workers vaccinated. So that's a wonderful thing. Having a vaccine for COVID-19 is certainly cause for celebration. Public health officials have high confidence in its safety and efficacy. However, it will take months to vaccinate everybody who wants it in the state of Minnesota. And as I mentioned earlier, there's still much to learn about the vaccine, but here's what we know today. The vaccine is going to be provided at no cost. You're going to need 2 doses of the vaccine, whether you end up getting the Pfizer vaccine or the Moderna vaccine, both of them taken about a month apart. The state's distribution plan focuses on maximizing impact, equity, and transparency. They're using a phased approach to vaccination. Phase 1A includes people working in healthcare settings, and then, of course, people who live in long-term care facilities, those folks that have been impacted so hard that we all care about and want to make sure that we make them as safe as possible, as quick as possible. People in this category will be contacted by their employer if they're in a healthcare setting or the facility where they live to let them know when the vaccine is going to be available. I think in the city of Edina, our frontline workers, our EMTs, are going to be getting the Moderna vaccine sometime in January. So that's a wonderful thing as well. No final decisions have been made yet on the remaining phases. I mentioned earlier that there is much we still don't know. For example, we don't know if someone who's vaccinated can still spread the disease to other people, how it works for younger age groups, or how long the immunity from the vaccine lasts. Those are things yet to be determined, but we are grateful to have the vaccines here. Here's what you can do now. Get a flu shot if you haven't already had one. This is going to be important in the scheme of things. So get that flu shot. It's not too late. And then be patient as the priority groups are vaccinated. We're going to get to everybody, but it might take until the end of first quarter to get everything done, and maybe into the second quarter of the year. And make sure you continue those good practice habits that I think people have been doing such a good job of in Edina. I see most people wearing masks all the time now, whether they're indoors. A lot of people wearing them outdoors. Make sure you stay at least 6 feet away from each other when you're together. And then I think one of the keys has been washing hands, keeping your hands clean. And then, of course, staying at home if you feel sick. And don't forget, the city website has our own dashboard. So make sure you visit the city website for updates on vaccinations and anything else that would be COVID related that will be helpful to you and your family members. So there's a lot going on for people as they try to be together safely. We encourage you all to stay close to home. This is Jim Hovland. That's your Mayor's Minute. I want you all to stay healthy and have a great holiday season and a Happy New Year. So let's continue to take care of each other, and we'll get through this together. We'll talk to you soon.